Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for May the 13th. We're honored to be here on the territories of the Lekwungen-speaking people, the Songhees and the Esquimalt First Nations. And with that, I'm happy to introduce Dr. Bonnie Henry.
Thank you and good afternoon. So for today, our update for May 13th in British Columbia, we have an additional 16 people who have tested positive for COVID-19 in the province, bringing our total of people who have tested positive to 2,376 in British Columbia. That includes 877 people in the Vancouver Coastal Health Region, 1,137 in the Fraser Health Region, 125 people in Vancouver Island Health Region, 180 people in Interior Health, and 57 people in the Northern Health Region. We continue to have active outbreaks, 20 of them in our health care system, including 15 in long-term care or assisted living and 5 units in acute care facilities. We are now up to 299 residents or patients who have been affected and 190 staff. There are no new community outbreaks, and all of the ones that we continue to follow have remained the same. So that leaves us with 385 active cases around the province. Of those, 59 people are hospitalized right now, and 14 of whom are in critical care or ICU. We've had one additional death in British Columbia, bringing our total to 132 people who have died from COVID-19. And our hearts and our condolences go out to the families, to the communities, and to the care providers for those individuals. 1,859 people have recovered from COVID-19 in British Columbia, and that's about 78% of the people who have been affected by this pandemic in the last few months. Yesterday, the province-wide survey called Your Story, Our Future was launched to gather insights from you about the experiences and actions that we have taken in British Columbia, or we've had in British Columbia in our COVID experience so far. This survey is available, as I mentioned yesterday, on the BC CDC website, so it's bccdc.ca, COVID-19 survey, and if you go to the BC CDC website, it's right up there on the front page. The response has been outstanding in the last 24 hours since we announced it. Over 75,000 people have responded as of noon today, so thank you for that. This is valuable information to help us understand where we've been, who's been affected, and where we need to go. If you haven't completed the survey yet, please take a few minutes to fill it in. It's only about 10 to 15 minutes. We want to hear from people across the province, and I encourage people to support people within their close families, their bubbles, people who may not have access to or have less access to technology or the internet. You can do it online, and particularly seniors or people who speak other languages than English or Chinese, you can do it by phone call as well, and that number is 1-833-707-1900. I'd also very much encourage young people to complete this survey. Young people may not realize how important and how valuable their voice is. We need to hear from you. So please go on to the BC CDC website. And I know many young people are very web savvy, so this survey shouldn't take you too long. And your opinions and your experiences are very valuable to us. We are asking a wide range of information in this survey, and there is a reason for that. We need it to help us understand the similarities and the differences in the experiences that we have all had. And this pandemic has affected all of us, but in many different ways. And it is important that we recognize these unique challenges that different people have. And we know this from challenges that we've heard about in some of our more remote communities, having access to testing, having access to health care services, both for COVID-19 and for other issues that have come up. And as well, we know that the challenges for people who speak different languages, for people who are in different ethnic groups, for people who are different ages are very different. That is why we are asking for information in this survey around things like your socioeconomic status, geography, your ethnic status, what groups you identify with. We're also asking information about travel, about being around people who might have been infected with COVID-19, and mental health and health information. This helps us understand unknown impacts, the unknown or unintended consequences that have happened both from the virus and the pandemic, but also from the measures that we have put in place that have impacted us all. It informs the decisions we make going forward, and importantly, it ensures that we have the supports we can put in place to address any potential disparities that have come about either from the response to COVID-19 or because of the dramatic economic impacts that we have experienced across the province. So also today, I'd like to take a few minutes to speak to things like public gatherings and social interactions. I know that it's been challenging for all of us to really understand what it means, going forward, particularly as we go into phase 2 starting next week. There's a couple of things that I want to remind everybody. First is that my order limiting public gatherings to fewer than 50 people remains in place. But that is a maximum of 50 people. And that only applies provided you can provide for them to maintain that safe distances between us, and that you have other provisions in place that ensure that those contacts are safe. So if you're in a smaller venue, if you're inside, it might be many, many fewer than 50. So we need to think about making sure that we fit the number of people to the venue that we are looking at. This order will remain in place for the foreseeable future. And one of the most important pieces that also is not going to change is that if you are sick at all, or any concerns about that, or if you are around somebody who is sick, you need to stay away. Stay home and stay away from others. Nobody wants to bring this virus into their community, into their home, into their residence, or into somebody else's home. And we have seen many examples of that where people have inadvertently, in most cases, spread this to their friends, their contacts when they've gone out to places, they've gone out to birthday parties, they've gone to funerals, they've gone to nightclubs. So we need to be very, very cognizant of that in the coming weeks and months. But while there's uncertainty, the path really is not black and white, and that is the challenge that we are all going to face. We've never done this before, and we all need to try and do our best within the important guidance that we have around the key measures we all need to take to keep us safe. So there are a few things that I'm going to ask everybody to remember. One is smaller groups. The more people we have contact with, the more chances that we have of spreading this virus. So we are in contact with them, we're in contact with their contacts as well. So smaller groups, the fewer faces, the bigger spaces, important to think about, and minimizing the time that we have to be in close contact. So it's about, location, duration, and relation. So thinking about who it is that is on our circle, in our family, in our household, that we need to potentially protect. So I'm going to give you a couple of examples that might help for some situations. First of all, I've talked many times to young people, and I know that this has been a very challenging time for young people, particularly teens who are in that transition phase of your life, in high school and moving on to early university and getting a job, and what are you going to do this summer? So if you're a teenager, I know spending time with your friends for many of you is incredibly important, and you have done wonderfully by doing that online, by connecting people with your friends virtually. If you're thinking about adding others to your bubble, to your small group that you have gone through the first part of this pandemic with, then keep your group small. So find those people that you really, it's important for you to spend that time with, and keep them small and consistent. Make an agreement with them that you'll be part of their bubble and they can be part of yours. So the more people you see, the more chance that somebody is going to have COVID-19 and they may not realize it. So every time you include somebody outside your household in your bubble, you're also connecting with everybody in their household. So their parents, their brothers and sisters, others who may be in their expanded circle. So that can be a lot of people if you're not careful. Make sure when you are going out, it's with one small group of people and only one small group of people. So don't change it up every day. That's not going to be helpful right now. You need to commit to each other for the coming weeks and months that you're going to protect each other and care for each other. When you are out, don't share things like drinks or fries. Go outside if you can, rather than going inside. And if you are going to hang out inside, stay apart, sit apart as much as you can, and keep your visit shorter. So that's one of the things that we can do to protect our families and each other. I've had a lot of questions as well from faith leaders about religious services. And we know that, and I have been so incredibly appreciative, as we all have, of how many of our faith leaders have stepped up and helped us out through this very challenging time for all of us. And they found many creative ways to do that. And I'm very heartened by the stories I have heard about how people have reached out in a virtual way or by telephone in other ways to support members of their community. Starting next week, religious services can be held with safe physical distancing. So that is a maximum of 50 people still, and that is provided that many people can fit into your facility. That may be way too many for many places of worship. We have seen outbreaks starting from religious gatherings, so be mindful of the room you're in, how long the service may be, and who are your congregants who are there, particularly if they're elders, people who are more likely to have severe illness with this virus. So hold your gathering in the largest room possible. Keep the group small. If you can, the maximum is 50, but that means you have to maintain that physical distance. You need to make sure that you're continuing to modify those parts of the service that are important so that you don't have that touching of multiple people with physical contact. We want to as well make sure there's opportunities for hand hygiene when you're going in and out of the facility. That may mean that you need to have shorter or multiple services to keep those and keep those virtual connections going, especially for the older people of your congregation. One other scenario that I'm hearing a lot about are the retail stores. So like large grocery stores that we've seen who've remained open, larger shops and department stores can have more than 50 people if they can maintain enough space between people so that there isn't congregating and crowding. As well, we can safely go to those stores, and we need to know the time we're in the building is short, and we can be efficient in how we move through them at this point in time. We want to make sure that people aren't gathering, that it's not a time when you're going to spend a lot of time talking in close contact with people. You want to make it more efficient and have some combinations, perhaps, in many places, of online and in-store. So spacing, small numbers, physical barriers are incredibly effective, what we call engineering controls. We've seen that in grocery stores and pharmacies and other places that have stayed open. Having that plexiglass barrier protects me from you and you from me, and those are incredibly effective. Cleaning of surfaces and opportunities for cleaning of hands, also incredibly important in retail stores. We know that many people have had concerns about seeing their clinician and seeing their doctor over this period of time. It is important, particularly if you have underlying illnesses, that you follow with your physician on a regular basis, that you continue to connect with your physician's office. Care has been provided, mostly virtually, over the last few weeks, with minimal in-person visits, unless it was urgent or essential for care. This will continue to be the case, but will gradually change as we move into phase 2. If you need to see your doctor or your dentist or your physiotherapist, call their office first, and they will let you know what you need to do. It will be different than what we have had before, in that we will not be having people sitting in a waiting room area together, for example. So we'll need to space people out when they're coming in for appointments. There will be opportunities for hand cleaning. There will also be opportunities in some situations where you might be asked to wear a non-medical mask to keep your droplets in. Direction is going to be provided, and we're working on that with the regulatory authorities, the colleges, for all the regulated health professions, on incremental changes and the guidance they need to move forward over the next couple of weeks. Finally, I want to talk about a social situation that we may all be facing in the near future. You know, hosting a barbecue, for example, at our house, and that is something that we want to be able to do in the coming days and weeks. So if you're inviting friends to a barbecue, take a few minutes about how you would do that safely. And this is where, again, we need to consider our own circumstances. If we have somebody in our household who has serious medical issues or is going through cancer treatment, or if we have elderly people in our household, we may not want to be doing this type of socializing right now. We need to keep our connections small to protect them. But if we are looking at expanding our circle and we can do that safely, then outside is always better than inside. Keep the group small and consistent. So make a pact with some friends or neighbors that you're going to be within each other's close contacts over the next coming weeks. The fewer people that you see, the better that you will be. The less chance that you're going to bring this virus into your household or spread it in your community. Provide individual servings. So buffets are not something we want to see in the next coming weeks. This is going to be a challenging time for us for the next weeks and months. And those are the types of things that we need to start getting in the habit of now. So making sure people can stay safely apart as much as possible. So if you're having a barbecue outdoors, space your chairs away from each other so that households are together. That way you can enjoy each other's company without having the risk. We've talked about this before, but there's two ways we can increase the number of people we have contact with, and we need to do that very judiciously, or we can increase the safe contacts that we have. And that again goes back to those measures where we have fewer people, we don't congregate, we don't spend too much time, and we make sure that we have things like physical barriers in place to protect us if we can't keep our safe distance. And right now, no hugs and kisses with people who are outside your household or your circle. So from the examples I've shared, I realize there are some common things that apply to all circumstances, but there are some things that we each need to take in and think about ourselves. So smaller groups, fewer faces, shorter time together, bigger spaces. Those are things that we need to keep in mind over the coming days. So location, where we are, the duration of our contact with others, and the relations. Who is it that we are going to connect with, and who is it that is at risk potentially in our community? Who you may see before and afterwards, and who you need to protect. So think about who is in your life at higher risk, and who is in contact with the people that you're in contact with. I understand that lots of people really want clear rules that apply to everybody, but the reality is that our path forward is individual based on our own unique circumstances, and that goes for businesses as well. We can give the guidance, and we are giving the guidance, that the parameters that we have to work within. But for everybody, they have to make that decision for their own business, whether it's to protect their own employees, given the who it is that works in their business, whether it is protecting their customers, if you have a lot of people who are at risk, or whether it is a business model that may not work for you at this time. Those are decisions everybody's going to have to make as we move forward. Only you and the people in your life can help you decide that. So use this weekend coming up to think this through, to think about how you might do this, to have those conversations. Have those conversations with your children, with your grandparents, with the parents that are in your life. Are you comfortable inviting people into your circle your close circle, the people that you are going to hug? And if so, how are you going to do that safely? Everybody in British Columbia has shown incredible determination, and that is why we are at the place that we are now, where we have cases decreasing, the burden of this virus in our communities is decreasing. And now's our time to very thoughtfully and cautiously move ahead with opening things up again. Let's keep going, but let's remember, of course, to be kind, and be calm about this, and stay safe. Thank you.
Thank you very much, Dr. Henry, and I want to join Dr. Henry in expressing my condolences to the family and friends of the person who passed away in the last 24 hours from COVID-19. They lived in the Fraser Health Authority and were in long-term care, and I think, again, it reminds us in the case of that family, in the case of the 131 families of people who passed away from COVID-19, the sense of loss that this has brought us. And even though it has brought us together and there has been an extraordinary response to COVID-19, that sense of loss is felt, and it's felt by us here, and I think it's felt by the whole province. And we wanted to support those families as that family grieves because of the loss yesterday, and the 131 other families who have lost loved ones to COVID-19 in BC. As Dr. Henry has said, we had 16 new cases today. That's 2,376 cases. And in acute care hospitals, in our hospitals, we're down to 59 cases from, I believe, 63 yesterday. That's 33 in Fraser Health and 2 in Interior Health and 1 in Vancouver Island Health, 2 in Northern Health, and 21 in Vancouver Coastal Health, and only 14 in critical care, which tells us of the efforts of British Columbians in flattening the curve continue to have impact, although it also tells us that COVID-19 is with us everywhere in the province. I wanted to note that the level of the number of people in acute care hospitals is coming back with 66.6% occupancy in BC today. That's about 3,700 vacant acute care beds that are available to us at this time. And for the second consecutive day, more than 5,000 people visited emergency rooms in BC. That's not back to the pre-COVID levels of between 6,000 and 7,000, 6,559 on the 9th of March, for example. But it does reflect that people are returning and using the healthcare system when they are required to, when they need to be in an emergency room. I wanted to join Dr. Henry in recognizing, and I think this reflects the willingness of people in BC to take part, to be involved personally in the effort to fight COVID-19. I think by the time we returned from yesterday's press briefing where we talked about the survey, already thousands of people had taken part in that, and 18 hours later at 9 a.m. this morning it was 75,000, and we're very, very hopeful that more of you will take part. And just in that effort, I just wanted to say that you can do so online at www.bccdc.ca/COVID-19 survey, and it's currently available in English, Simplified Chinese, and Punjabi. For those who are unable to complete the survey online, as Dr. Henry has said, you can call 1-833-707-1900, 7 days a week between 8:30 and 4:30 p.m. And assistance is available in 150 languages. Once you've completed the survey, please look to other people in your bubble who you can help complete it as well. If they don't have the same facility with websites, that could be elderly loved ones, people with language barriers, people with less access to technology. We also want to encourage, as Dr. Henry just said, young people to take part as well, because we need to hear from you. This is the way that British Columbians can help us in responding to COVID-19 in the coming months and years, and we would very much appreciate it, and we are appreciative that every time that Dr. Henry has asked British Columbians to do something, they have responded in large numbers with generosity of spirit, and we're very appreciative of the way that's happened in this case. I wanted to update you on surgeries in BC. We've continued to do urgent scheduled surgeries, sometimes called urgent elective surgeries, as well as emergency surgeries in the period from March 16th to May 10th, for example. 20,165 such surgeries, which include some of the most challenging surgeries in the province, surgeries that are required within 28 to 48 hours on one hand, and some of our most significant, some of our most challenging elective surgeries or scheduled surgeries have been done in that time. That's 20,165. By health authority, that's 3,452 in Interior Health, 4,179 in Fraser Health, in Vancouver, I'll start that over again because I didn't get it right. 3,452 in Interior Health, 6,216 in Fraser Health, 4,179 in Vancouver Coastal Health, 4,014 in Vancouver Island Health Authority, 1,195 in the Northern Health Authority, and 1,109 in the Provincial Health Services Authority. And I should note that 10,619 of those were urgent elective surgeries or urgent scheduled surgeries, and 9,546 were emergency surgeries, as I've described, which shows the extraordinary work that has happened in the healthcare system while healthcare workers and healthcare professionals have been dealing with this pandemic. I note that we have canceled, as I think I've reported before, 16,872 surgeries this week. Staff are working through that list. That's not the full list of canceled surgeries because since we tend to do surgeries in 3-week blocks, many of the people who would have received surgery, for example, at the end of April into May, didn't have their surgeries postponed because they weren't scheduled at that time, but they are obviously significant priorities. But staff are working their way through that list this week. I'm going to have a report on numbers tomorrow. I apologize. I would hope to have that today by Health Authority, and we'll have more information on the number of people who have been called. What I can tell you is those calls began almost immediately after us making the announcement and have really continued in earnest since Monday of this week. I wanted to make one more set of comments just about travel this weekend as we approach the Victoria Day, the May long weekend in BC. And just to say that, just to repeat, that if you do not need to go somewhere, even if it's a second home, even if it's a place you go to every Victoria Day weekend, the way we can help one another right now is not to engage in non-essential travel. Now, we don't want to, of course, be judgmental. Sometimes people make the judgment that a trip is essential. But if that is the case, if you've made that judgment and you're confident in that judgment, then I think if you're going to go to, for example, Seashell, there will be a time in the future where we'll encourage everyone to shop locally in Seashell. But for the moment, if you are going to go to Seashell, or if you are going to go to the Shuswap, or if you are going to go to the Gulf Islands, bring your own food, your necessities there, so you don't, you're able to maintain at least some semblance of a bubble at that new location. It is very, very important to do so and be respectful of the communities that you're visiting and their concerns and their needs right now. But that being said, this is a good weekend to stay at home, to stay with the ones you love, and not to travel. In closing, I want to touch on, I think, the connection between those points, our commitment to surgery renewal, is we are pulling out all the stops to get people the surgeries they need. It will take a long time, and we are fully committed to it. But as we've said many times, our success and our timing of that will be dictated by future events, like the potential for a second wave that we've talked about, especially last week, of COVID-19, potentially in the fall, or a resurgence in cases at any time. A resurgence of COVID-19. I think we need to reflect on that and what would cause it. This long weekend and our anticipated move to phase 2 next week are times of some relief, I think, for lots of people. There are also times where we can forget ourselves and the skills that Dr. Henry has equipped us with to stop the spread, the skills we've used effectively to get where we are right now. Those that have kept most of us safe and have protected our hospitals from being overwhelmed by the virus. Our job in the coming days, our job this weekend, our job in the weeks to come is the same. We must maintain physical distance, wash our hands, cough and sneeze into our sleeves, and stay home if we are sick. Everyone involved in surgery renewal, everyone involved in long-term care is counting on all of us to follow the rules, not the temptation to bend them. We must stay 100% committed to our role in stopping the spread. Our job now is to prevent a COVID-19 resurgence in BC. Nurses, doctors, patients, and all healthcare workers involved in surgery renewal are counting on us. And if we do our job, they can do theirs. So this weekend, this May long weekend, and all through the summer, let's stay 100% all in our BC COVID-19 effort and make our surgical, social, and economic renewal the success we want them to be. Aujourd'hui, nous annonçons 16 nouveaux cas pour un total de 2376 cas de COVID-19 en Colombie-Britannique. Nous sommes attristés d'annoncer un nouveau décès lié au COVID-19 dans la région de santé de Fraser pour un total de 132 décès en Colombie-Britannique. Nous offrons nos condoléances à la famille, aux amis et aux aides-soignants de cette personne, ainsi que tous ceux qui ont perdu leurs proches. Parmi l'ensemble des cas confirmés de COVID-19, 59 personnes sont actuellement hospitalisées, dont 14 en soins intensifs. Les autres personnes dont le test de dépistage a été positif sont en isolement à leur domicile. À 9 h ce matin, plus que de 75 Britanno-Colombiens ont répondu à notre sondage. Nous devons obtenir un éventail de réponses aussi large que possible. Actuellement, nous avons reçu très peu de réponses venant de personnes âgées et de jeunes hommes. Une fois que vous avez rempli le sondage, s'il vous plaît, tournez-vous aux personnes dans votre, qui vous pouvez aider à le compléter. Il peut s'agir de personnes âgées, de personnes souffrant de barrières linguistiques, de personnes ayant un accès moindre à la technologie ou de jeunes qui pourraient ne pas réaliser à quel point leur participation est précieuse. Nous devons entendre tous les segments de la société de la Colombie-Britannique. Merci de contribuer à la promotion du sondage auprès des populations les plus difficiles à atteindre. Merci beaucoup. Thank you very much. We're happy to take your questions.
Thank you. As a reminder to everybody on the phone, please press *1 to enter the queue. You are limited to one question. I would also ask that you please unmute your phones. You will not be audible until I call your name. First question is from Marcella Bernardo, News 1130.
Hi there, Dr. Henry. I really appreciate the examples that you've given us today about what people should be doing when it comes to protocols that they're implementing as they try to widen their social circle. An example I'd like you to give us some clarification on is if people have been isolating in two separate cities and they're clear that they've been safe for more than 2 weeks, is it okay for people to travel, say, to the interior to visit family and spend time with them, or are you still saying people should stay close to home?
Yeah, so that's a little bit complicated in that, yes, of course it is, if it's essential this weekend. This weekend we're still saying stay close to home as we gradually move into this. But I know there are circumstances where it is important to visit people. And I know, for example, a friend of mine, his elderly aunt is on her own. Her husband, his uncle, died very recently during the pandemic, and he's going to go spend some time with her this weekend to help her clean out the house, make sure that she's okay, because she's been on her own unexpectedly for a number of weeks. So those are things that we have to be patient with people, and yes, those are the types of things that may be essential travel. For this weekend, we're still looking at essential travel. But yes, come the next week and into the coming weeks, those are the things that we want to be able to do to make sure that we can support our family in other cities and other parts of the province. So it's kind of a mixed answer, but yes, if it's essential this weekend, then do it, but do it mindfully, as we mentioned. Make sure that you don't have to go and contribute to the lineups in the local grocery store right now, because we're still in that transition period.
Tanya Fletcher, CBC.
Oh, hi there, Dr. Henry. We've heard about a COVID-19 case at Grand River Meat Processing Plant in Abbotsford. Workers tell us they weren't told about it until 3 weeks later. So remind us how the province is managing cases at high-risk workplaces like these and what rights workers have to be informed of for their own safety.
Yeah, so with every case that we have, there's a case investigation that's done by public health, so it depends of course, on where the risk is. And so there are many rumors, perhaps, where people may not know the whole story. So yes, we do not tell individual personal health information to a workplace, to a community. That is your own personal information. And we, in public health, if there is a risk to others, whether it's in a workplace, whether it's in a community setting, whether it's a household risk, then you will be informed of those risks. And we know that we do that very effectively. We were just talking about this with my public health colleagues last night, some of the data that we have, because these are important things that we will be following, tracking on a daily basis going forward. How many cases do we have? What's the time frame for doing our case investigation, for managing every single contact that they have had? And those are statistics. I can tell you that it's close to 10,000 contacts who have been connected directly by public health and asked to isolate because they were in contact with somebody with COVID-19 over the past few months since we started this pandemic response. So if workers are concerned about risks within their workplace, that's where they can go to their occupational health and safety leads, their union leads, if that's appropriate, and also to WorkSafe BC.
Next question is from Keith Baldry, Global News.
Hi, Dr. Henry. Thanks for this. I'm getting some confused questions from hair salon owners, restaurateurs who keep looking at the May 19th reopening. And I note your health orders say they expire on May 30th. And last night on our town hall in Global, I believe you said you're going to be amending those orders. I'm just wondering if you could bring some clarity to that, when that's going to happen, and what the hair salons and personal services and restaurants are going to be looking at in terms of date for reopening.
Yeah, so the potential date for reopening is the 19th. That's when we're starting this phase. And we know that, I've said many times, that we are working on guidance in consultation with the different sectors. And WorkSafe BC is leading that with public health. And that guidance, I know for some of these sectors, it's already in the works, and there's been ongoing consultations, should be coming out within the next day or so. And so each individual owner needs to look at their own circumstance and see whether and how they can meet the guidance before they're able to open. So it's going to be a progression over a period of time, depending on individual situations. So I will be amending the orders to make sure that they apply to that. Right now, for example, the orders for salons and other personal service establishments will look at them meeting specific guidelines before they're allowed to open, but that could be as early as the 19th. Same for restaurants, so I'll be amending that order as well, and that's in the works right now.
Next question is from Jennifer Saltman, Vancouver Sun.
Oh, hi there. Minister Dix, you've estimated that the cost in wages to implement single site plans at long-term care facilities to be about $10 million per month. There's some concern that it won't cover the wages or other costs associated with single siting. If it ends up costing more, is the province willing to cover that? And if not, how do you think it will be made up?
Well, I'd be happy to provide some more detail on that. I'll be updating on single site tomorrow. I'll be happy to update you on those questions. When we engaged in this, we looked at the number of people who would be affected by it across the long-term care sectors. It appeared, and in fact, it ended up being about 7,400 individuals were working at multiple sites, and we've moved to act on that. As we noted, we were taking responsibility for the wage portion of what we had proposed, and the $10 million was an estimate, and we'll be more precise on that. But those changes, that part of the change involving single site, is something that we're taking responsibility for. It's a public health order, and it's a public health emergency, something that we started, as you'll remember, in March, and have continued on now in April and May. I'll be reporting new information on that tomorrow, and I'll try and get you some more information on that. So the $10 million was an estimate, just to give you a sense of the overall cost in the sector of making such a change. And I think that the results, I suspect, will be slightly higher than that, and we'll have more information on that tomorrow. I should say that I think because of the changes that have been made in the years leading into this, there was some progress had been made. A lot of our effort to increase staffing levels in long-term care in BC that had occurred in the previous 2 years included people from moving people from part-time to full-time status. That's how we were able to fill and increase staffing in publicly funded for publicly funded beds, whether they be health authority owned and operated, whether they be nonprofit or for-profit publicly funded beds. And so we made some progress on that, and that progress is continuing, and I'm happy to get you more information in the future. But the 10 million was an estimate, but it's our commitment to fulfill that promise at the provincial level.
Next is Maria Weisgarber, CTV.
Oh, hi there, Dr. Henry. I had a question about Health Canada approving the first test to look for antibodies in a person's blood indicating exposure to COVID-19. I'm wondering if you have an understanding of how that kind of testing might roll out in BC, where we're at with validating those kinds of tests here, and also if there are any sort of cautions that you would like to share about what that immunity actually may mean.
Right. So it is one of the tests, the one that was approved by Health Canada, and I expect there will be more in the coming days. It is one of the ones that we have been using here and validating here in BC, so that's good news. And we're part of that whole process. As I've said a few times, we have a couple of plans for how we are looking to use serology testing. One of them is to do testings of samples of blood from different age groups in the population over time, and there's been a recent study in Japan that used a very similar methodology. This is something that's being led by researchers at the BC CDC, including the lab in BC CDC, and it is a research protocol our investigation protocol that we've used in the past, for example, in 2009 for the H1N1 pandemic, to understand how many people at different age groups in our population have been affected. So that's one of the first things we'll be using it for. We're also using it, we will be doing additional studies related to the survey that we're talking about. So there will be looking at how serology can help us understand the impact of the pandemic broadly in the community. So that's part of it. The caveats that we have, and we've talked about this a few times, is that these tests are not 100% accurate. So even if it's 99% good at detecting the virus, the antibody in your blood, and 99% good at telling you when it's not there, we still have a problem when there's low levels in the community of having false positives and false negatives. So that's something we need to build into the protocols that we're using. The other thing that we've talked about nationally and internationally is we still don't know yet how long antibodies last in the system, and whether what level of antibody is needed to provide protection from reinfection. So we have an immunity council that's been put together, including a number of really great key researchers from British Columbia. Dr. Mel Krajden from BC CDC Lab is one of them, and they are looking at all of these different aspects. There's 4 different areas that we're looking at. One is having validated tests, looking at population level infections and how the test can help us understand that, but also looking at the basic parameters of what it means if you have a mild infection and you have antibodies at a certain level. Does that mean that you have protection? How long does that protection last? We don't know the answers to those questions yet. So along with our trying to detect the antibodies, we need to work nationally and internationally to understand what it means to have antibodies in your blood. So lots of questions. I fully expect, though, that this is going to be really helpful for us. Having good tests that we know the parameters, we know how good they are at either detecting it when you have it or detecting it when you don't have it, helps us start that process. And by the time we get to the fall, I'm hopeful that we'll have more information about what it means when you have antibodies and how long that protection may last.
Next question is from Alex McKean, Toronto Star.
Hi, Dr. Henry. Thanks for taking my question. I wanted to ask about the Statistics Canada excess data numbers that were released today. You've actually previously already provided a greater amount of detail than what was released today for the British Columbia data anyway. And you've also spoken about deaths that may be indirectly caused by COVID-19 and how we might glean some of those from the excess data deaths. So I wondered if you could just explain to us a little bit about what kind of information will be needed going forward, both in British Columbia and outside of British Columbia, in order to draw meaningful conclusions about indirect COVID-19 deaths.
Sure, and you're right. The data that was released this morning from StatsCan looked at very similar to what I presented. The numbers of deaths per day and whether there was excess deaths. And I have not had a chance yet to talk with our scientists at BC CDC about how their numbers correlated with ours, but they are based on the vital statistics data from each of the provinces and territories. So I expect they will. And what they have showed nationally overall is that there has not been an increase in excess deaths. So I find that interesting. I don't know why there is that discrepancy at the moment, but we are in the process, and the group that is looking at this from the BC CDC is getting that information now. The time frame is a little bit different for the national numbers as well. They only went up to a certain time in March, where ours were a little bit more timely. So what we are looking at now is getting the cause of death information from vital statistics here in BC for every single death during those periods of time, and then looking at which are the ones that we can associate with COVID-19 and which ones are caused by other things that could be the impact of things like the canceled surgeries or lack of access or people not accessing health care because of concerns about COVID-19. So part of that will come from our vital stats data, but part of that is really important information that we need to get from individuals, and that's why this survey is actually very helpful. We are asking people if they would participate in the survey to understand some of those issues that may have affected them during this period of time. And I would love to have the extra data. It is coming in, and I've had some conversations with BC CDC about that, but we will in the coming weeks provide you with some more of the details of what it means, what the excess deaths were caused by here in British Columbia.
We have time for one more question today. For anyone on the line that did not get to ask a question, there will be a statement released later this afternoon. For recommendations on protecting families and communities from COVID-19, visit bccdc.ca. For non-medical questions about the province's COVID-19 response, visit gov.bc.ca/COVID-19. And for a full listing of the provincial health officer's orders, visit gov.bc.ca/PHO guidance. Last question is from Veronica Beltran, CKPG.
Hi there, Dr. Henry. Thank you for taking my question. We have a concern from an inmate at the Prince George Correctional Facility who says that he doesn't believe the facility is following proper or enough procedures to keep inmates safe from COVID-19. Are you aware of any issues regarding the safety of prisoners at this institution, and what is being done to keep inmates and staff safe? Thank you.
Yeah, so we have been working very closely with our provincial correctional facilities and, as you know, with our federal colleagues in the federal correctional facilities, given the very tragic outbreak that we saw at the Mission federal correctional facility. There are indeed processes in place at all the provincial correctional facilities. We're working very closely between public health and the infection control people and the Provincial Health Services Authority, which provides medical support to all of our provincial correctional facilities. So I am confident that there is processes in place and that infection control processes are being followed in each of those facilities, and I do get reports on a regular basis from our the provincial correctional facilities and the federal correctional facilities now as well. If the inmate has concerns, there are people that he can talk to within the facility, and I am confident. I have not heard of concerns expressed from any of our provincial correctional facilities at the moment.
That's all the time we have for today. Thank you.